They say that health is wealth and that nothing is more important than your physical and mental health. And if we think back just over the past 3 years, this becomes very apparent. And as we continue to navigate and heal from the damaging impacts of COVID, the world's population continues to age, and we're spending more time and more money on our health. But health systems are typically slow on the uptake of innovation, the type of innovation that we need to respond to the complex health and wellness challenges that our global population is experiencing. Here in Alberta, though, we believe that we can create the solutions, build the technologies, and export the knowledge the world needs to build healthy and well lives. Well, welcome to a special series on the brief called Advancing Missions and Moonshots. I am your host, Brittany Brander, and in this series, I talk to leading experts, business leaders, innovators, and thought leaders across Alberta and Canada to explore solutions to the world's biggest challenges in energy, agriculture, and health. And my guest today is Reg Joseph, the CEO of Health Cities, a leader in healthcare innovation located right here in Edmonton, Alberta. Welcome to the show, Reg.
Good morning, Brittany. How are you?
Great, thank you. So over your career, you have cemented yourself a reputation as an expert in healthcare innovation and scaling those solutions to realize not just the health benefits, but the economic benefits as well. And you've lent your expertise on this topic and have written a piece on improving healthcare delivery through innovation. So we'll get into the details of what that looks like. But let's start big picture here. Canada's healthcare system is very big, it's very complex, and many people don't quite know how it works. I won't ask you to explain the intricacies of the healthcare system because we could spend hours talking about that. But could you give us a sense of where we currently stand? What's the state of the healthcare system in Canada right now? Where are we doing really well, and where are there maybe some gaps?
Yeah, great question. So, Brittany, first of all, one of the things that's different with Canada than other jurisdictions around the world is that our healthcare system is actually multiple systems, which are all provincial and then territorial systems, all rolled into one system. So, unlike UK or Germany or France that have actual national run health systems, our health systems are provincial. So, and the reason why I make that distinction is because some of the challenges we're going to talk about stem from the fact that we've got some of those provincial breakdowns, not breakdowns, but provincial divisions and so forth. In terms of healthcare in general, I know the best way for us to look at it is to look at international work that's been done that compares Canada to other jurisdictions. About a year ago, a report came out from the Commonwealth Fund that takes a look at healthcare systems across the G11. And one of the things that's surprising to many Canadians is that Canada now is number 10 on that list. So if you ask the average Canadian kind of, hey, where are we in terms of the G11? Most people would say, oh, we're probably in the top 3, top 5, but we're not. We're number 10. The only country below us is the US. And so that gives you a sense of the state of where we are. And that's not new in the sense that we have been falling on that list for some time. But to your point earlier in your intro, Brittany, the COVID pandemic really brought that out to bear. And so now I think as a public, we're far more aware of the frailty of our healthcare systems in Canada.
I mean, 10 out of 11 is not great. We've got some opportunity to become, leaders, I guess, in helping people live much healthier lives. You mentioned in your paper that the healthcare system is historically very resistant to change or innovation. Talk to me about that.
Sure. And you know what, that resistance to change and so forth, I like to change the language a little bit because it's really not a negative connotation in terms of the health system doesn't want to change. What it's really around is our health systems with good intention are being conservative in the sense that before they adopt anything new, they want to make sure that it makes sense for the population. Not only does it make sense from a safety perspective, where we would get Health Canada approvals and those kinds of regulatory approvals, but also does it make sense from a public taxpayer perspective in terms of, do we buy this new technology? Is it going to provide the value for the patients that we want it to? And is it cost effective? All those kinds of questions. So it comes from a good place. The challenge is we haven't developed enough systems and processes to be able to look at novel new technologies and how we test, try, and scale them in our systems. And so as a result, we tend to say no more often than we say yes. Another challenge is because we don't have those kinds of innovation systems in place, we often bounce back to procurement. And I'm going to go down this track just for a minute. So Alberta is a great example. Alberta Health Services is the largest health authority in Canada. And so when we talk about procurement, Alberta Health Services has a pretty robust procurement team, and they do procurement deals around the world to make sure that Albertans are getting, whether it's the best gloves or needles or medical devices or what have you, into our system. And that needs to be there. And the way that they do that procurement for such a large organization makes sense. Our challenge, though, is when we've got new innovations that are coming in from Canadian companies, for example, a lot of those procurement requirements, those companies won't meet, which is multiple sites of manufacturing, all kinds of supply chain guarantees and so forth, that these companies won't have that. And so what ends up happening is that we will only buy into those innovations when those companies have been acquired by larger companies, like a GE or a Medtronic or one of those companies. And so the problem that creates is that those innovations quite often are being paid for by public tax dollars, whether it's federal or provincial, sometimes both. We as individuals don't get access to those technologies until much, much, much later.
Right.
What we need to figure out, which is what other jurisdictions have figured out, is how do you still keep a robust procurement system for established innovations that are coming out? And how do you test and try new innovations that might not have all the supply chain requirements, all the manufacturing requirements that large companies would? So that's where we're failing. And we're failing across the nation in the sense that no province has really figured this out.
Yeah, I just want to pick up on one of the points that you've made there. It kind of creates some slightly like higher kind of barriers to entry for any new companies or new products. If they have to fulfill all these requirements, it's like, oh, well, I'm just kind of a small fish in a big pond, what's the point, right? And so then, yeah, we do lose out on a lot of potentially life-saving innovations and technologies. So I just want to talk a little bit more about some of those opportunities that you are seeing across the system to address these gaps, to bring in that innovation.
Yeah, sure. I mean, in terms of sort of the innovations within the province, we have got all across the spectrum. So, let's start with the new and exciting digital health and artificial intelligence. We have a local company spun out of the University of Alberta called Meadow AI. And they have developed artificial intelligence back end to imaging devices. And what this enables one to do, and we've deployed a project on this, is you can have untrained individuals taking images remotely using handheld devices. What's great about that is that if you've got communities that don't have ready access to get to a diagnostic center for imaging, then you can actually do the work in the field. So we've partnered up with Meadow AI and delivered this just west of Edmonton in two of our Indigenous communities, Alexis and Paul First Nation, where we're actually screening kids using a handheld ultrasound, but you don't need an ultrasound technician anymore because of the corrective factor provided by Meadow AI and its machine learning backend. So that now just changes the paradigm in terms of there's all this coordination in terms of getting families into diagnostic centers from rural scenarios into more urban areas. We don't have to do that anymore. We can image on site, transfer those images wirelessly to a radiologist, and complete the entire value chain that way. And so we're bringing health to the people as opposed to bringing people to a central location.
And is a technology like that much more cost effective in terms of the investment in the technology and travel related to going out to these communities and, personnel?
Absolutely. When you just think about the coordination that's required, you said it, the travel, even in terms of the specialists and the environments that you need to have to be able to house these individuals as they come in, we've just flipped all of that around, right? And you no longer need to have any of that infrastructure. You can reduce it down to the device and an image and the individual, right? And so we take off all of that overhead, which is really where a lot of the costs in our health system lie. It's sort of in this overhead that we have. If I could, I'll talk about a couple more really quickly. On the diagnostic side, we have a company out of Calgary called Scientra. They've developed a gene expression test for early detection of breast cancer. So a simple blood test will tell you your risk profile for breast cancer. And as we all know, with any cancers, early detection is where we can succeed. So the earlier we can detect, the faster we can get these individuals down to a track where we're actually managing. And in many cases, now we can prevent cancer. And then lastly, because health is such a big area, so I've talked about digital health, I've talked about diagnostics, we are also playing in the whole pharmaceutical world or therapeutics. There's another company out of Alberta called Entos Pharmaceuticals that has a really interesting technology around where the pharmaceutical industry is going. So rapidly area of growth is looking at drugs that can impact inside a cell. So now we're talking about DNA, RNA, you might have heard mRNA vaccines. These are all things that are happening inside the cell. One of the challenges is delivery. Getting a drug inside the cell is challenging. There's very few ways to get a drug inside the cell. And the ways that do exist that can get drugs successfully in often have high toxicity levels, so they're not preferred. So this Alberta-based company, Edmonton-based company, Entos, developed a delivery vehicle, a novel new delivery vehicle that can get drugs inside the cell, but not cause toxicity. And what's great about it is that they're not a drug developer themselves, they're a platform. They partner with drug development companies to get their drugs inside the cell. So Entos has just struck a deal about a year ago with Eli Lilly. It was the largest biotech deal in Canada right out of Alberta.
That's crazy. I mean, just excuse my ignorance for a second, but you're kind of blowing my mind. I had no idea that drugs were delivered outside cells and there was an opportunity to deliver it inside the cell. I mean, this is way past my area of expertise, but I am like fascinated that someone has even thought like, okay, this is a problem and, we've got a solution for it. And, we are exporting that knowledge right here in Alberta. Like I'm wonderstruck.
And this is the true benefit of when folks talk about the research capability and capacity that we have in Alberta. When we look at our research-based medical schools, University of Calgary, University of Alberta, we are doing world-class research. And to your point, Brittany, this whole idea of understanding that the market is moving towards internally delivered drugs and methods of getting there, that we've developed this platform, all gives a real good credibility to the caliber of research that's happening in our post-secondary institutions. What's wonderful is that in many cases, those research projects that happen at research institutions don't reach the bedside for a variety of reasons. But in this case, we are. And so it's really exciting that Alberta developed technology is actually going to revolutionize how we do drug development for this class of drugs around the world.
Well, and then you can just imagine like the scaling opportunities from there too, you know? Um,
Absolutely, absolutely.
what else do we have in Alberta? I want to talk a little bit more broadly about kind of this role that Alberta can play in
Sure.
this global opportunity, because
Absolutely,
we don't ever play small in Alberta. You know, we're like, okay, well, what big global challenges can we solve? It's and
absolutely.
generate like local prosperity in the meantime. So it just, what is the economic potential here? Well, I'll flip that. What is the what are some of those like health benefits that we can provide to the world in terms of aging populations, curing acute diseases, just mental health, etc.
Yeah, no, great question. First, let me talk a little bit about the assets, because I know you wanted to get to that,
Yes.
as opposed to say the companies per se. So one of the things we have that's unique in Canada here, and we touched on it earlier in the conversation, is the fact of the size of our regional health authority. So Alberta Health Services is the largest health authority in Canada. We have 4.5 million people covered under that one single health authority. We have very strong data sets that are longitudinal for Albertans here, unlike anything that occurs in any other province. So you're right, the power that we have to sort of drive innovation, given the system that we have in place, we have a lot of assets ready to roll here. And then tying back to what you and I just talked about, which is the research base that we have tied in as well, it's actually a real powerhouse opportunity. Where can we impact and opportunities for growth and impacting the world? I think a really interesting area for us to get into uh, is how do we manage rural remote communities?
Mm.
That's a big challenge. We know this in Alberta because we don't have clinicians in many of those communities. They don't have family physicians. We don't have access. Well, that problem actually exists around the world. You think of other northern nations around the world. Think of other indigenous populations. Think of Greenland, for example. Think of sub-Saharan Africa. There are many, many, many communities that getting access to a physical clinical site or a hospital is challenging to do.
Mm-hmm, mm-hmm.
So I strongly believe by addressing our own challenges here, developing new solutions, many times using our own technologies, Beto AI, a great example of that, handheld ultrasound, and figuring out new models of care that provides accessibility for our rural and remote communities to have full access to healthcare in a way that is completely different than our sort of hospital-based system.
Mm-hmm.
Um, Not only will change outcomes in Alberta, it could be a great model for Canada because every province has these communities. But as I mentioned too, it actually can help right around the world. And so I see Alberta, and you said it, Brittany, we think big in Alberta, absolutely. And we should think big in terms of healthcare. How does our system become a platform for innovation from around the world? Not only could we attract Alberta and Canadian companies here to work within our system to innovate and create new models, we could go global with that. We could
Mm-hmm.
bring German companies, Israeli companies, Japanese companies here as well. That will benefit us as Albertans in terms of all the new innovations and technologies that are coming out. But they could stem from here, and we could build a new way of a cluster around health. But it's not now around a pharma industry or medical device industry. It's really around the healthcare system, and using all types of innovation to drive new health outcomes or better health outcomes.
Do you know what that potential looks like in terms of the economic potential and investment in jobs that we could create from this opportunity?
Yeah, absolutely. The Canadian Venture Capital Association released some data around the amount of investment that's gone into Alberta-based companies in 2022. And we've seen a significant uptick in terms of investment in technology-based companies. So this is broader than just health, but many of those companies are health as well. And I'll have to confirm the numbers, but something like $729 million of investment went into Alberta-based companies. Therein lies the potential with these companies being able to attract financing. And much of that financing is not necessarily local. It could come from other regions of Canada and sometimes even other regions outside of Canada as well. So we're attracting investment into the province.
Mhm.
That then creates jobs and more opportunities here. If we can fix the other piece, which is enabling those companies to test, try, and scale here, then we can also build manufacturing capacity here. And we have basically the growth of a whole new industry that's going to contribute to our GDP going forward. So this is where I get really excited, because those base pieces, one healthcare system for 4.5 million people, huge data assets and resources, very strong research capability, world-class, putting all of that together in a nice small environment. So, under 5, this is a really nice environment. And don't forget, Alberta is kind of unique globally in the sense that you have this population of just under 5 million, but we have huge genetic diversity in that 5 million, right? That's different than other jurisdictions around the world, where they might have some of the pieces, where they might have a nice small population. Norway is a great example. They have 5 million people, but from a genetic diversity perspective, it's very different than Alberta. Right? So we have huge genetic diversity. That's where the world is going in terms of next medicines and so forth. We have that already built in. So it's kind of neat. We really are sitting on the edge of something quite spectacular here in terms of how we can transform. We're not too big, but we're big enough and we're diverse enough with all the right assets to drive these innovations forward.
Like a Goldilocks jurisdiction.
That's how
health innovation.
Yeah.
So what do you see as some of those key needle movers to addressing that testing and commercialization kind of gap that you're seeing in the province? What do you see in terms of policy or otherwise that we kind of need to get right in order to unlock that piece?
Really good question. There's a few things we need to do. First and foremost, I alluded to it a little bit earlier. We need to separate the adoption of innovation from procurement. We need to set a different set of rules for the adoption of innovation. And we can still run those companies through the ringer on the procurement side, but let's work with them on the innovation side first to figure out, can this work? Does it work for Albertans? Does it work for our health system? If it does, then let's work with them at that level to enable them to scale. Once they are able to scale, absolutely put them through the front door, just like every other company that needs to come in on the procurement side, right? So that is the first thing we need to do. The second thing we need to do, and again, I did allude to this before in terms of where we need to go as health systems in Canada, is we need to move outside of the hospital. We need to move into community, because the management of chronic disease is not best managed in a hospital. It's best managed in community. So we need to move the clinical capability and, more importantly, the clinical capacity out into community. And if we do that, then we tie in the innovation side. We can now do a lot of the work that I was talking to you about in terms of how do we tie in rural and remote communities, how do we use digital technology to provide better access and so forth. So we need those pieces to line up. Lastly, I do think we need a bit of a culture change, and that might even involve some policy change in terms of how our health system not only delivers healthcare, but is also improving healthcare outcomes by adopting innovations. And I want to be clear here, because there's been some talk in the past about the role of our healthcare system playing in economic development. I don't think our healthcare system has enough capacity to be an economic development player as well. So my proposal is that the health system really just focuses on healthcare outcomes. How do we deliver better health to Albertans? But in doing that, we need to bring in new innovations, new ways of doing things, new models of care. So that's the lens that the health system should look at it with, not in terms of, oh, how are we going to support the growth of GDP in Alberta? No. How are we going to improve health for Albertans in our healthcare system? What makes sense? What innovations do we bring in so that we can create better accessibility, decrease the overhead on clinicians, and increase Albertans' outcomes? If we can just do that piece, the economic development side will take care of itself. Right.
Yeah.
And then
like
that
overflow
pulls,
benefits.
right. And that pulls that responsibility off the health system, because honestly, it doesn't make sense for the health system to be focused on economic development. But if they can just focus on healthcare and delivering the best healthcare and the most effective healthcare, then the innovation piece will come in, and then the rest of it, we can, on the other side of that, we can focus on the economic development, what are the tax policies and all those kinds of things to make that piece work. But we just need an innovative healthcare system, not to help companies, but to drive better health.
Right.
And if we do that, then I think we've got what we need.
What is one insight or idea that you would like people to take away from this paper?
I think it's more broadly what I've been surprised about when I started down this track is I always knew there was a strong innovative culture in Alberta. So I said, yeah, Alberta, we're going to make this thing happen. To be honest, though, I was quite surprised at the volume and the caliber of innovations that are coming out of this province. I think we punch way above our weight. And I just talked about a few of them. I could go on. We could spend another hour, Brittany, on the exciting companies and technologies that have come out of here. Even things that are just coming out of clinical, like we've revolutionized, and it just came out in a New York Times article, we revolutionized how stroke care happens around the world. And that was all developed here in Alberta.
How have we revolutionized stroke care around the world?
It's a great question, and it's a long story, but in a nutshell, they basically, a group looked at the entire value chain of how we manage strokes. When do we send in EMTs? When the EMT comes in, what sort of assessment does that EMT do? And then once that assessment done, where is that individual sent? And how quickly do they get to a stroke center? They completely changed that entire flow for a different clinical paradigm and revolutionized stroke care. And in that case, there really weren't a lot of companies involved. These were our clinicians. And so maybe to answer your question more directly, so not only do we have great innovations and companies in Alberta, the other thing that I've found working with our clinicians in the field is their aptitude for innovation. We've done some very interesting deployments with health cities and a number of companies in terms of home health monitoring and imaging and so forth. All of those happened because we had innovative clinicians, particularly nurses, who are the backbone of our healthcare system. They drove those innovations. And so I was pleasantly surprised to see how excited our healthcare practitioners were about adopting these technologies. So we do have all the pieces. We really do. There's just a few sort of administrative policy things that we need to adjust to really roll on this.
Well, thank you for tuning into this special episode of The Brief. You can read Reg's paper in its entirety at definethedecade.com. We will be releasing new episodes in this special series periodically, so make sure that you are subscribed to Alberta Better on Apple Podcasts, Spotify, or wherever else you get your podcasts to be the first to access new episodes. Thanks for listening, and we'll see you next time.